I think to really make a patient comfortable and willing to share like their sexual health history is to start off with no assumptions, especially with trans patients, because there tends to be an assumption that if you transition to being a man, it's because you're sexually attracted to women, or vice versa. And so understanding the separation between the gender identity and the sexual attraction is really important from the get-go. And then also just being, showing no surprise, I guess I'd say, as you start, and being willing to dive a little bit deeper and understanding like the attractions and understanding that they change throughout the course of care as well.
In general, it bothers me when someone asks me what surgeries I've had and if I've had these surgeries, assuming that there's just a set of them. So going back to people having this linear trajectory of their trans experience, I think it's upsetting, and it's also disrespectful for someone to assume that they can have access to that information without having it actually be relevant.
I would want providers to ask questions about what kind of partners I'm having, like am I having sex with males, females, other transgender people, what is involved in those, like is it, what kind of sex, like is it, is a penis involved, is a vagina involved, is it fingers, is it oral, because I don't know, I mean, we all have different body parts and sometimes we want to use those body parts, and some, vice versa with the partners that we have, and they need to be honest, they need to be open to the possibility of us doing, all different kinds of things, because all of those things have different impacts and influences on, our sexual health.
It's like a lot of conversation all just kind of like leads back to STDs and HIV and stuff like that, and it's kind of like, being that, trans is such a minority, it's kind of like, they feel as if just that every trans girl, every trans man is going to be prone to, some sort of sexually transmitted disease or whatever. And I just kind of like to be weaned away from that, so that they know that, not everybody's promiscuous, and, everybody's just not, a lot of girls aren't sexually active, a lot of trans men aren't sexually active like that, I just like to be, I just like for them to talk about my overall health, opposed to just the things that are, placed upon the trans community.
I would want my provider to know that I am polyamorous, so I engage with multiple partners, but the way that I engage with each of those partners may be different. So understanding that I'm attracted to people with different genders, and that doesn't necessarily inform the body that they have or the sex that we have. So really just understanding that I'm very queer and my sex is too, so not using terms like your boyfriend, your girlfriend, your wife, your husband, because I don't have any of those, and I doubt I will. So recognizing that partners appear in different ways, and just because a person is engaging in a lot of sex or has a lot of different partners does not mean that they aren't engaging in safer sex practices.
I would want a provider to ask me how I identify my gender, how I identify my sexuality, how do I feel in my body, which is really important, because a lot of times I feel very dysphoric and doctors will go to grab me, and I am not a touchy-feely type of person, and so that feels invasive. So preparing me for whatever they need to do in order to figure out what's going on for me, I feel like, especially because they are speeding through, there's not a lot of how can we trust each other, get comfortable with each other. I mean, being in a doctor's office I guess to me is a very, I mean, we're taking off clothes, and the doctor is not my partner, the doctor is not me or my mother or my parents, so it's a very vulnerable place to be. And so the relationship to me has to be affirming and understanding. And so if I'm going to disrobe in front of you, I don't want to get funny looks. I don't want to get, any of your negativity towards me, because this is a very, very vulnerable space. And so it's really important that you adjust your own self before working with me.
One thing I would really like providers to ask me is my reproductive desires, and I don't think it necessarily comes up because there tends to be an assumption that if you're trans, you don't necessarily want to have kids, and I don't think that's true. Like, I would love to have children, but it's never been asked, and especially just having the discussion prior to initiating any type of like hormone use, I think is really important, and just assessing, what are your options prior to what are your options later in life. I think that one was really important for me, and it wasn't discussed.
Having a provider that understands trauma, that is trauma informed, and also seeks consent throughout the process, that was very important to me. And so it was a lot of little things that made it a positive experience for me, of just constantly checking in, because I hadn't had a PAP in a while, and so asking me, is this okay? This is what I'm going to do. So informing me of each step so that I wasn't surprised, and making sure that I was comfortable throughout.
What I'd really like providers to know about my sexual health needs is that I do want to discuss them, even if it may be somewhat uncomfortable for me to do so. There's a lot of history tied in with being trans and with body discomfort, and even if I'm not very open about it, it's not because I don't want to discuss.